Robert F. Kennedy Jr. does not want you to know about this, but the American Academy of Pediatrics does. Whooping cough cases are trending up. Here are a few recent headlines. So there's a teenager in Blue Springs High School in Missouri who became infected. Cases are up in Davidson County, Tennessee. Texas is really struggling. Florida is struggling. North Carolina is struggling. The West Coast is struggling. This is affecting and is going to affect the majority of the United States. I'm Wanda Frazier, health educator. This is Your Body and You. So data on pertussis cases is a little bit confusing. Pertussis is a reportable condition to the CDC, but their publicly viewable data lags actual cases. So it looks like we're close to 30,000 cases in 2025 so far. Not quite, almost 30,000 cases. And the last time we had numbers this high was more than 10 years ago. So cases are not slowing down. So far, we have 13 deaths. So over the past year, Kentucky has suffered 3 deaths. They do have a school mandate for vaccinations, and the numbers look above board. So sometimes, no matter how hard you try, the numbers go in the wrong direction. Louisiana suffered 2 deaths earlier this year. It took a couple of months before a notice went out to the public or even to physicians. And this occurred right after Robert F. Kennedy Jr. was confirmed as Secretary of Health and Human Services. Yes, there was a confirmed bias against vaccinations in that state. Both Washington State and South Dakota suffered a death. A death in Idaho was an adult. There are a few more, but those are the ones I know about. A little background. Pertussis is also called whooping cough. So pertussis is the medical term. Whooping cough refers to the sound of gasping for air from the extreme coughing. So even previous generations referred to this disease as the 100-day cough. It's bacterial, it's highly contagious. It's generally transmitted by air droplets in close quarters or shared items, tangible items. It can be transmitted without or before symptoms develop. There is a lag time between exposure and symptoms. It may be days, it may be weeks. Generally, infants develop the worst symptoms. They generally suffer the most. There are stages of symptoms. The early stage may look like a cold. It may not be identified until the symptoms worsen. Here's a graph from the CDC describing the different stages of symptoms for pertussis. There is a thick mucus that develops in the lungs, which triggers the extreme coughing. There may be gasping for air. Some of the more serious symptoms or complications include skin turning blue or gray because of lack of oxygen, vomiting, rib fractures, pneumonia. Pneumonia is what generally sends people to the hospital. There's also a lot of discussion in the medical community about the relationship between pertussis and asthma. It's kind of a chicken or the egg question, which came first, which complicates the other. Either way, it's double trouble. So, and also because pertussis is bacterial, antibiotics often are prescribed within a short window early in the symptom stage. After about the first week of symptoms, the antibiotics seem to be less effective. As the disease progresses, doctors and hospitals focus on symptom management. And for those who survive, it's a long recovery process. General recovery time is measured in weeks, not days. There may be long-term effects like scarring of the lungs or asthma that's difficult to manage. There are more. The list goes on. Feel free to look that up. It's all very sad. As in a lot of bacterial diseases, there are antibiotic-resistant strains of pertussis, but so far in the United States, those cases are low. However, I would not make any assumptions about that for the future. As a population, the long-term trends in pertussis may affect infant mortality rates in the United States. We probably won't see that data for at least another year, maybe 2 years, and I would not be surprised if infant mortality goes up because of this and several other factors that have happened over the last year or two. If the immunization levels are low for pertussis, they are also low for the other two diseases prevented by the same vaccine. We'll see how this progresses. The vaccine. The vaccine for pertussis is either the DTaP or the Tdap vaccine. Please talk with your doctor or your child's pediatrician about this vaccine recommendation schedule. DTaP is for young children, but infants are not eligible for the vaccine for the first couple of months, and they are not fully protected until they have had all their doses. So be diligent, especially if you are around newborns. And when everyone around an infant gets vaccinated, the infant gets some protection. This is called cocooning because it protects the infant from exposure to pertussis. Tdap is for older children, adults, and pregnant women. This is generally considered the booster. These vaccines offer protection from tetanus, diphtheria, and pertussis, but immunity does fade for this vaccine, so it is difficult to assess the protection within a population. So stay diligent. Talk with your healthcare team about risks and ask for suggestions. I'm not a doctor. Check on your friends and family members. Send them this link if you feel that they may use the information. Another way you can help. The American Academy of Pediatrics can use all the support we can give them right now. They recently lost a bunch of federal funding because they are sticking with their own vaccine recommendations. Millions of dollars. I'll attach a link in the comments. We will need them more than the current health secretary admits. Actually, we will need them more than the current health secretary. He's not helping. So repost this, attach a heart in the comments, comment something useful, because none of us have time for nonsense right now. Stay safe. This is Wanda Frazier, your body and you.